So you keep referring back to neuroplasticity. I guess the idea where we are now is that the major benefit of the psychedelic experience is this neuroplasticity, this ability to change rigid patterns, that we're normally stuck in, and sort of create new pathways. Is that where we're sort of seeing the peak effect of psychedelics?
That's often, yes, assumed to be the case. This is tricky again because all the neuroplasticity stuff is based in rodents and in vitro cells in a dish. It's very hard to measure neuroplasticity reliably in humans, and that's an ongoing question on how to do that. And so like 99% of it is us making inferences based on rodents again. It's like, oh, this seems to be happening in rodents. We know neuroplasticity is beneficial in other contexts, therefore it must be neuroplasticity driving the effects in humans. I think it's a combination of factors, right? I think neuroplasticity, based on what we know about how it works, can help potentially give our brain more resources to make new connections, to then encode new behaviors and change how we approach things and restore functions that might have been lost, like emotional regulation skills and abilities. Um, but also, we can't reduce psychedelics. I think we can't reduce psychedelics to their brain effects. Psychedelics induce these profound experiences where people process deeply, deep emotions that haven't been processed for decades. They have insights into their life, their relationships. They have trauma that comes up that can then be processed and reconsolidated in potentially healthier ways. So there's this huge experiential component that if you ask anybody who goes through psychedelic therapy, they talk about the experience that they had, right? They talk about the profound insights and shifts psychologically that they had, which then translate into long-term benefits. So I think psychedelics are this synergy between experiential and neurobiological effects, and we can't just exclusively focus on one at the expense of the others. But people seem to disagree because of kind of what I would say is longstanding biases in psychiatry of biological reductionism to reduce things to the brain and ignore experience. And there's a whole historical reason for that because current psychiatry, biological psychiatry, was a response to like Freudian and like, well, not just Freudian, but psychoanalysis. So they kind of absolved any association with subjective phenomena in psychoanalysis in the 50s or 60s. They're like, oh, we're a biological discipline, we're a part of rest of medicine. But they threw the baby out with the bathwater, right? And I think psychedelics are kind of bringing in, it's like, no, we need both. We can't just focus just on neuroplasticity, just on the brain. We gotta, or chemical imbalances or whatever you want to say. It has to be this experiential side too. And so I think psychedelics are a good example of that.